Everyone, I'm joined today by Health Minister Greg Hunt and the ACT Australian of the Year, Secretary for Health, Professor Brendan Murphy. We'll be bringing you an update today on vaccines, but before I do that, I've spoken to Premier Marshall this morning regarding the bushfire on the outskirts of Adelaide, adjacent to the Adelaide Hills. As those waking up in Adelaide this morning, they'll be very aware of that. The smoke haze very visible and very real. And he indicates to me that they were able to move quickly last night, but there is still work to be done to get this under control. We've offered federal assistance, none is required at this stage, and so we just look forward to a day in Adelaide where they're able to get on top of that and everybody can remain safe. But it was a very positive report from the Premier, and we wish them all the best today, and we thank all of those volunteer firefighters. It's quite difficult terrain where this fire is, and so there's been some difficulties accessing the area, but no doubt they will overcome, as they always do, and I thank them for their very selfless service today. It's a year today since the first case of COVID-19 in Australia, and what an extraordinary year it has been over these past 12 months. But a year on from that fateful day, Australia, we know, has done better and managed this together, working together, better than almost any other country in the world today, as we look at the terrible situation being experienced in many parts of the world, some quite close to here actually, some further afield. Our thoughts and support is with all the nations of the world as we seek to get on top of what has been a calamitous event for the world over these last 12 months, and indeed longer than that in some cases. So far, over the course of this summer, despite some very serious threats, working together, we have so far been able to avoid and prevent a third wave of COVID-19 here in Australia. Now, we can take nothing for granted, as I said after the National Cabinet meeting on Friday, but that effort, whether it was in Brisbane with the new strain that had been able to get outside the quarantine facilities in Brisbane and being able to move quickly, and having been in Brisbane late last week and there as the restrictions started to ease, or having returned to Sydney on the weekend for the first time in about 6 weeks, and to see how people continue to manage with the easing restrictions there and how they've been able to get on top of the outbreak, and of course the outbreak that also occurred in Victoria. Once again, systems tested. Once again, Australians tested. Once again, Australia and our systems have passed that test. And so I have a simple message to Australia. Thank you. Thank you, Australia. Thank you that you have put us in a situation that is the envy of most countries in the world today. We intend to keep it that way. We intend to remain vigilant. We intend to continue to set the pace and set the standards by which we can ensure that we keep Australians safe, and we save lives and we save livelihoods, which have always been our twin goals. Now, a couple of weeks ago, when I stood here with the Health Minister and the Secretary, we gave you an update on where the vaccines were at that stage, and we undertook to keep people updated on that. And it's important that we be as transparent as we possibly can. This is a global challenge like none we've seen in a very, very long time. And there will be challenges along the way, and we are addressing them. Just earlier today, the Therapeutic Goods Administration, Professor Scott, announced that they had approved the Pfizer vaccine for people aged over 16 years here in Australia. I note that this is not an emergency approval, as has been done in some other jurisdictions around the world. This is a formal approval under the ordinary processes of the TGA. And we are one of the first countries in the handful of countries to have gone through that comprehensive and thorough process here in Australia to ensure the approval of that vaccine. Now, their work will continue, as it has been in parallel, regarding the AZ vaccine as well, and we look forward to their thorough work, but also their timely work, as they've demonstrated in getting us to where we are today on Pfizer. Now, we remain on track to have those vaccines in Australia and ready to go from very small beginnings, I should stress, very small beginnings. Starting small, we scale up as we outlined in the plan that we advised to you some weeks ago. We're more looking at late February than mid-February now because of the challenges that we've seen in the production and delivery for both AZ and Pfizer around the world. You'll be very aware of the situation and the pressures that we're seeing globally. This day last week, I was holding a further video conference meeting with quite a number of the national leaders throughout Europe, but also in Israel. And they are under considerable strain and stress there in countries that are experiencing large numbers of fatalities every day and their vaccination programs under extreme stress. Australia has taken the time. We've been watching and learning from the experience overseas, and so we remain within the guardrails of the time frame that we set a few weeks ago, but obviously that is going to continue to come under challenge for events and circumstances that exist well beyond our shores. And it was for that reason, around August of last year, that we took the decision that we didn't want to be in a situation where we were completely reliant on the production of vaccines overseas. So we took the decision, we put the arrangements in place with CSL and AZ to ensure that we would be able to produce our own vaccine here in Australia, and that is happening now. That is underway now. Yes, we paid a premium for it. Yes, we had to put the capability in place with CSL to achieve that. And yes, we're even involved more broadly in the development of their production facilities in Melbourne. But that was the right decision for Australia, because as much as you can, you want to be able to control as many things as you can in this country when dealing with COVID-19. That has been our form. That will continue to be our form. And with that, I'll ask the Health Minister and the Secretary to give you some further detail.
Thanks very much, Prime Minister, and to Brendan. Today's another very important step forward in protecting Australians, in saving lives and protecting lives. As the Prime Minister said, it's a year to the day since the first case of COVID-19 was diagnosed in Australia, and it's worth reflecting on that journey briefly. We know that the world is likely to reach 100 million formally diagnosed cases within the next 48 hours. We know that the world has already lost, formally, 2.1 million lives, and no doubt the real figure will be higher because of undiagnosed or unrecognised cases. In Australia, there have been 7 consecutive days of 0 cases of community transmission. 9 out of the last 10 days have had 0 community transmission. There have been no lives lost in that time. And we are back to 0 Australians on ventilation and 0 Australians in ICU because of COVID-19. At the same time, in the last 24 hours, for which there are full figures, there were 570,000 cases globally and 14,000 lives lost, and 6 million cases over that last 10 days and over 125,000 lives lost. That comparison is almost unbelievable, the difference between where we are in Australia and overseas. What it shows, though, is that with those numbers, with a pandemic raging across the world, we have to be prepared for, and we have to presume that there will be new outbreaks. We hope there won't be. But we've seen South Australia, Victoria, New South Wales, Queensland all face outbreaks in the last 2 months, all be tested and all pass that test. And that's a testimony to the work of all Australians, all governments and all health officials involved in all of the chains of the containment and capacity process that we set out in February. That structure remains the guiding light. As part of that, one of the things which we saw yesterday was that our 5-year-old vaccination rate, for the first time, passed the 95% mark, 95.1% for the December quarter. So through the pandemic, vaccination rates have actually gone up, which, if you'd asked me at the outset, I would have thought with all of the challenges would have been almost impossible, and yet Australia remains a great vaccination nation. So a critical part of our COVID-19 strategy is a focus on safety and the delivery of vaccines. And that's why I'm delighted, and we're delighted, that the TGA, the Therapeutic Goods Administration, which I believe is arguably the best medical regulator in the world, has approved the use of the Pfizer vaccine in Australia. It's approved now for Australians 16 years of age and older. I think when last we spoke, we were anticipating it might be 18 years and older, and so that's a broader range of population than anticipated. That changes our vaccination strategy so as those 16 and above will now be included in phase 2B. And so this is an example of the evolution of that strategy as the approvals and facts and science are developed. We have, on the advice of the committee led by Professor Brendan Murphy and also ATAGI, the Australian Technical Advisory Group on Immunisation, which is led by Professor Alan Cheng and a very distinguished team, secured 140 million vaccines, one of the highest dosing rates per head of population in the world. The commencement remains on track for February, as the Prime Minister has said. The completion remains on track for October. This approval by the TGA is one of the earliest in the world for a full approval. We know that the European Medicines Agency and the Swiss have already made such an approval, but Australia is amongst the earliest. I spoke last night with the regional and Australian heads of Pfizer, and they indicated, as the Prime Minister has said, that we are likely to have, on their shipping advice, which they've now been able to confirm, first vaccines in Australia ready for distribution in late February, so within the guidance that we'd previously provided. That's likely to start with approximately 80,000 doses per week, if not more, but let's be more conservative on that. Further guidance for March and beyond will be provided across the globe by Pfizer in mid-February. So they are making global decisions on those allocations, but continuous supply was their goal, objective, and their anticipation and guidance as of last night. With regards to Astrazeneca, the international Astrazeneca supplies in Australia are likely to commence slightly earlier than had previously been anticipated, early in March. And if there's more guidance on that, we'll obviously provide it. That's subject both to TGA approval and to shipping. I think that's important. And the domestic AstraZeneca production via CSL is likely to see supplies of approximately 1 million doses per week commencing in late March. And so that's an incredibly important part of it. Both companies have experienced global supply challenges, but we're in a fortunate position as a country because of the decisions that have been taken and our ability to focus on safety. In particular, if you ask me for the two most important decisions of the whole pandemic, one, the 1st of February last year, the advice that Professor Murphy gave to both the Prime Minister and myself and then to the National Security Committee that we should close the border with China. But secondly, the decision to pay a premium for an onshore, secure, sovereign vaccine manufacturing capacity via CSL. That puts Australia in a vastly more secure position than almost any other country in the world. And I think that's probably, of all the decisions, the one which I reflect upon, and it was a difficult, challenging decision at the time, and we had to work very hard to have that onshore vaccine manufacturing capability, but CSL and AstraZeneca have stepped up. Now we move to the next steps, and we continue this. I do want to thank the TGA, the Department of Health, the states and the territories. People have worked right through Christmas, New Year, summer, right through weekends, in many cases right through the night, with documents being completed at 1:30 a.m. and forwarded. So we focus on the continuous assessment, the continuous procurement, the shipping, the distribution, working with the general practices, with the RACGP, the AMA, the states and territories on that rollout. But we're in a very strong position, and I want to thank, as the Prime Minister did, all of those Australians who've helped keep us safe, and all of our extraordinary researchers, medical professionals, contact tracers, pathologists that have prevented so far a third wave. But precisely because of the global risk, that's why we have to proceed with a safe, secure vaccine program. But Australians can have confidence. If the best regulator in the world approves the vaccine, it's safe and effective.
Thank you, Greg. Brendan.
Thanks, Prime Minister and Minister. I'll be very brief. I think this is a very special day for Australia. We are in this wonderful position of still having no community transmission, and yet we've approved through our normal, proper processes the first vaccine. We can now get that vaccine shipped to Australia, do the batch testing and start our vaccination program according to our schedule. As Minister Hunt and the PM have said, we also have one of the few countries in the world that have this luxury of having onshore production. We know that the whole world will be competing and there will be supply chain difficulties for vaccines manufactured offshore for every country in the world. We're already seeing that around the world. So once we start to get once fully registered, our Astrazeneca vaccine, and as I've said many times, it's a very good vaccine. It's a very good vaccine to prevent, both the vaccines are excellent, they both prevent COVID disease effectively and prevent severe disease. So once we get the local onshore production going, we will start to have a totally reliable supply chain. I should emphasise that the next few weeks, while we're waiting to get the final doses and get approval, is being spent 24 hours a day in preparation. The preparation that is going on for this vaccination journey is huge. We intend to get it right. We've got major logistics issues vaccinating 26 million people, and we're working very closely with our partners in the states and territories. We're doing very careful planning about starting up those clinics, gentle clinics, so that we can get going first with the border workers, the quarantine workers, the healthcare workers at risk of COVID, and the elderly and disability people in care and their staff. We're ready to go, we're planning. Very exciting, and very exciting that we have not had to do this in an emergency way because we have a crisis to deal with. We can do this in our normal, safe Australian way. Thank you.
We're going to start here and just move across, Doug.
PM, on the timing, I was under the impression that mid-February might have been possible. We're now talking late February. There have been issues in Europe with Pfizer. I had the impression that we were getting the Pfizer vaccine out of the US manufacturing rather than European manufacturing. Have we been affected by any of the Pfizer manufacturing capacity issues, or is the delay something else? And is there still a possibility that we could get more than 10 million doses of the Pfizer vaccine, or is that not possible or not necessary?
I'll let Greg cover that. First of all, I should say, no Australian vaccines, i.e. vaccines destined for Australia, have been diverted anywhere else. Let me be clear about that. But there are challenges for all of these big producers around the world for the reasons that I said before, but I'll let Greg.
Sure. On timing, our guidance was always mid to late February, and that would depend on the shipping dates. We had the shipping dates provided last night. I note that I think it's actually valuable to bring everybody into the confidence of the discussions with Pfizer. They have had to pause some of their supply to major nations. And that's had an impact on some of their programs. For us, we're commencing in exactly the window. Though we had not put a specific date, and I think on multiple occasions to questions from many of you here, we've indicated that the date that we would have would be dependent on approval and then on shipping times. And those shipping times were provided last night, which means that we're in a position to commence in late February, and our guidance had always been for a window. I would say that has undoubtedly been influenced by Pfizer's global capacity, and the fact that we are within our window is indicative of a very, very strong contract and a very, very strong position. So they reaffirmed to us that they are on track to complete all of their contractual contracts, timeframes and obligations. Second thing is On the selection and purchase of vaccines, we're guided by the medical expert panel. This is one where you would absolutely want the Australian Technical Advisory Group on Immunisation, led by Professor Cheng, and the Scientific and Industry Technical Advisory Group, led by Professor Murphy, to be the ones making the selection of vaccines. It's an entirely medical choice. And we've followed their guidance, and if they recommend more of any particular vaccine, then we'll secure it, and we are in a position to be able to do that.
We've secured enough vaccines to vaccinate our population 3 times over. Has the government confirmed what percentage would potentially be going to our Pacific or our Indonesian friends?
Yeah, the Foreign Minister and the Minister for the Pacific and International Development have been they've commenced the process of working with our Pacific Island neighbours, and the first step of that is to prepare them to be able to administer the vaccine. And so there's a fair bit of work going in and aid support to ensure that they're in a capacity to actually deliver the vaccine. And we're going through the rollout timetables and programs with them now. Obviously, they don't start the same time as we do here. But the first thing we need to do is ensure that they're equipped to be able to administer the vaccine across their population. So that's the first step, and I've had some fantastic messages back from our Pacific family leaders over the course of the last week. Those calls have been very well received. The Pacific leaders are very appreciative of the very proactive role that Australia has taken to ensure that they'll be in a position to administer that vaccine.
What happened in Norway? Will we be giving Pfizer to elderly Australians or terminally ill Australians?
I'll let Brendan do it.
So the TGA advice, I think, and we have obviously been concerned about this. I think for the very elderly and frail, I think that will need a very careful clinical decision. That's something that would need to be where the risks versus of the benefits of vaccination need to be carefully considered. So the vaccine is registered for all ages over 16, but there will be specific advice that ATAGI will be producing around particularly people who are very frail and close to end of life, which is that group that had the issues in Norway.
Mr. Hunt, just on the distribution, say ready by late February, so does that mean then in terms of people actually getting the injection that's likely to be early March? And just secondly, you said approximately 80,000 doses per week is the plan at the moment, but let's be more conservative on that. So is the figure revised down?
No, sorry. Firstly, we're expecting that at this stage, the first vaccinations will be delivered in February, and the 80,000 is the conservative figure. It could actually be higher, but we'll presume 80,000 doses per week is the initial distribution. And then, as I've said, Pfizer is around the world, and I think this is quite understandable, looking at all of their available production, and then they'll provide guidance in mid-February for March and beyond on a weekly basis.
How many doses will be coming out in that first shipment, for example?
So we're looking at 80,000 plus per week at the initial outset, and that's why we're presuming 80,000 would be available. And then, as we've indicated, later on we'll have Astrazeneca International from early March is the current guidance, and then AstraZeneca domestic at the volume of approximately 1 million a week on the latest advice that we had over the weekend.
I want to stress, though, that, what we're telling you here today is what we know today. And this is a very challenging global situation. And if there are any other things that occur between now and then we will stand here and we'll explain what's happening. And I think that's the appropriate way, I think, to engage in this vaccination program. We're going to be very upfront with Australians about this vaccine, about its timing, about its rollout. We'll be communicating very clearly about what the vaccine is and what families will want to know about the vaccine, and to make their own choices in an informed way about that. It was a topic that we discussed somewhat last Friday at National Cabinet, and we're all working together to ensure it can get out there on the ground. It's a very significant logistical challenge, one that is even more challenging in a country like Australia. But in speaking to Prime Minister Netanyahu, they've also had some challenges there, and they've been quite innovative in the way that they've been dealing with its distribution. So we're learning from everybody, and they're learning from us. Yeah.
The government's had a goal of 4 million doses by the end of March. assuming that we get this late February start at 80,000 a week, you're going to have to very quickly increase that rate to get to 4 million by the end of March. Are you confident that that goal is still realistic? And if we could get some detail about what kinds of weekly figures you'd be expecting by effectively the second or so week of March?
Yeah, well, look, I think it's difficult to predict these things. And the events of recent weeks, I think, will mean that 4 million position will be something that is going to be achieved in early April as opposed to late March. That's the reality of dealing with international arrangements. These are things that are beyond our control with these initial shipments. And so that's understanding. That's a combination of both the issues of AZ and Pfizer. But that's why we're updating you today. Greg, did you want to add anything to that?
Yeah, sure. So I think we're on track for the February commencement, the October completion, slightly earlier start for the Astrazeneca International than we'd imagined, slightly earlier start for the CSL production domestically than we'd imagined. The one variable here is that AstraZeneca globally advised us yesterday that, as we've seen, they've had a significant supply shock. And so that means that we won't have as much of that AstraZeneca International in March as they had previously promised, which is precisely why I maintain that the two most important decisions are the 1st of February China decision and the AstraZeneca onshore. That means, as the Prime Minister said, that April will be the period where we complete the 4 million. But the start, the commencement, all on track. Slightly earlier commencement for AstraZeneca International. Slightly earlier commencement for AstraZeneca CSL domestic.
So there'll be swings and roundabouts on this process, and you can expect that. And what you can also expect is for us to explain those as they occur.
Does that mean that the fact that it's going to be extended to people as young as 16 won't affect the delivery timetable at all?
No, that doesn't, because those under 18 were included in the last of the 5 stages already, but they'll be able to come forward to the general population stage, which is stage 2B.
Minister Hunt, I'm Professor Murphy. Where are negotiations up to on securing the Moderna vaccine, and what have been the struggles that have made it, currently not possible to secure that deal?
Sure, people have different views, and I'll obviously turn on the science of it to Professor Murphy. But from a policy perspective, what we've done is take the views of the medical expert panel, and I understand there are many people with different views. I would have to say that our medical expert advice has arguably been the best in the world, and I've got here the Australian Academy of Science release of last week. The Academy supports the current Australian government vaccination strategy, informed by the best available expertise and science, and it was headed Academy Statement on the Pandemic Vaccines and Misinformation. It was concerned that there were many who were going, or some, who were going outside of the expert advice to give widely available, freely available opinions. The opinions that we listen to are those of the medical expert panels, ATAGI and SciTag, one led by Professor Cheng, one led by Professor Murphy. And if they recommend a different vaccine, if they recommend additional doses of the vaccine, then we'll pursue their advice, and we've followed their advice so far.
So the Scientific and Technical Advisory Group is meeting regularly, and we are continuing to re-evaluate at every step our vaccine profile. Now remember, we've got the Novavax vaccine, we've still got whole population coverage of Novavax. We haven't seen phase 3 trial data for Novavax yet. We don't know, that may well be as good as the other vaccines that we've got. We are also looking at our mix of the mRNA vaccines. The Moderna vaccine is very similar to the Pfizer vaccine. There's not much difference between the two, but we are looking at our mRNA vaccine profile, our protein vaccine profile, our adenovirus vaccine profile all the time. And this panel, which is comprised people with deep expertise from the pharmaceutical industry, the medical and scientific industry, feels that our profile at the moment is the right one for us, but we will re-evaluate and make advice to government, and every piece of advice that expert panel has given to government has been accepted.
Hang on, I'm just going to give you one to go. I'm just moving across in the normal way.
Prime Minister, just in lieu of the other questions asked, to follow up on Moderna, have you tried to sign a contract with Moderna, and is the government struggling? And once we ramp up production, will you be looking at, or why aren't we looking at doing a 24-hour vaccination program like other countries if we have that surplus stock? Why don't we try and get through the vaccination program faster?
Well, I'll let Brendan and Greg.
Well, we are not in a crisis mode where we have to. We will obviously be looking at vaccination clinics that may well function after hours, but we're not in the situation of having to do 24-hour vaccinations. When you set up a scale like that, there are risks associated. We want to make sure that this is very, very risk-free. We want to make sure our supply chain works. We want to make sure our cold chain works. We want to make sure we've got the right numbers of appropriately qualified vaccination workforce. So we are standing up a rapidly expanding vaccination workforce. When it's up at full speed, matching the supply of the onshore production of vaccines, it will be vaccinating a lot of people. But
Moderna contract, have we tried to sign one with them?
We are continuing to evaluate and in discussions with all of the major companies, and those discussions are commercial in confidence. We're continuing discussions with all major vaccine companies.
One of the groups that has expressed concern about the lack of data from trials for the Pfizer vaccine and a lot of vaccines is pregnant women. Are they approved for this vaccine?
So we will be getting specific advice from ATAGI on that. There is really no data on, theoretically, the risk of this vaccine, Pfizer or Astrazeneca, on pregnancy is probably very low. You'll note that the US and the UK have different recommendations about pregnancy. We will be getting advice from ATAGI, and it's advice that's really just going to be based on the best guess of what the risks are at the moment, and that's coming very shortly before the vaccine is administered.
Okay. I think the Health Minister and Professor Murphy again, is Pfizer advised that they can ramp up beyond 80,000 doses to Australia, and we've seen in the UK they're stretching out the period between those doses. So has Pfizer said that they can move a bit faster? Can they ramp up over time?
Yes, they have, and they'll provide the advice though in mid-February. So it was a very valuable discussion. They operate on what they call pandemic supply at the moment. Normally they like to build inventory, make sure that they have reserves. For example, when we have the flu vaccine, the manufacturers ensure they have reserves, that we have reserves, we're able to roll it out continuously. Around the world, they are producing and then distributing. I think the question before was our source. Our source is Europe, and they're producing, they're distributing. Usually it's within 24 to 48 hours of manufacturing. So in mid-February they'll provide guidance on volumes for subsequent months, but as of last night the discussion was about continuous supply and then progressively ramping up. The advice from the regulator is 21 days, approximately, and so Brendan can give you more advice on the windows on either side, but our regulators recommended 21 days, and that's what we're planning to do in Australia.
So again, because Prime Minister, because we've got the luxury of doing this properly, we plan to make sure that we have enough vaccine to give everyone the second dose at the recommended time. We're not planning to manipulate the revaccination times. We're doing our planning on the basis that we can give people the recommended doses at the recommended intervals.
Just to clarify in relation to the AstraZeneca vaccine, they were originally looking at having about 1.9 million doses come in January and then 1.9 in February. Is that been delayed? Is that part of that delay that the supply shock you referred to? And Prime Minister, just in relation to Anthony Albanese's proposal to get former Prime Ministers Rudd and Howard involved in resetting the China relationship, do you have any perspective on that?
Well, I might come back to that. Let's deal with the health questions first. So I'm happy to come back to other questions.
Yeah, so on the international supply, that is the one variable that has changed because their entire global supply has changed. And so at this stage, we're expecting about 1.2 million doses of AstraZeneca International. But knowing that these figures can increase in any one day or decrease if there's been a supply change. So that was the advice as of yesterday. I spoke with the country head for Australia, and they were apologetic about that, but it's not anything to do with Australia. That's their global challenge, which was, I think, widely reported on the weekend. And so that's the variable in Australia, but at the same time, being able to deliver the international doses slightly earlier than anticipated, and the domestic doses slightly earlier than anticipated and at major scale.
Can we talk about what the vaccine can do and can't do? Because there'll be people watching you today that will think, I can stop wearing a mask, I can go to Bali, I don't have to quarantine. And in that space, can you just explain to people, is this a sterilising vaccine that stops people from getting infected, or is it a vaccine that stops people dying and getting sick? What are the implications of this? Can you transmit the COVID-19 virus even if you've been vaccinated and you're showing no signs of the illness?
Well, they're very good questions. I'm going to ask Professor Murphy to deal with them. But before he does that, I think the answers to these questions are important because it's important we understand the expectations of what the vaccine does. Let me be very clear. This year, 2021, will require us to continue to be vigilant. It will continue to require us to be engaging with all sorts of COVID-19 arrangements that can further mitigate the risk of transmission and keeping Australians safe, keeping livelihoods, keeping Australia as open as possible. There are limitations to these vaccines. There is far more to learn about these vaccines. In many cases, as I've been advised, there are positions where there is not enough evidence to say it definitively does X, but that doesn't mean it won't. It just means that the evidence at this point isn't in a position, and that's been a discussion we've been having with international leaders now for some time. And so it is important to understand that once the vaccines start, that doesn't mean you can jump on a plane to Bali the next day. It doesn't mean that the masks disappear if that's what the public health arrangements are in a particular state or territory, or the quarantine arrangements for return into Australia will end, or anything like this. This will build. It'll start at small scale, it'll build up, and it'll happen over a period of time as we've outlined over the course of this year. Of itself, it is not a silver bullet because there are still limitations to what these vaccines can do, and the best person to explain what they are is Professor Murphy.
Thanks, Prime Minister. These are really important questions and the population really want to know them. What we do know is that the two vaccines that we're rolling out now are both very good at preventing clinical COVID disease, and particularly severe disease. That's great. That's going to stop people getting clinically sick and hopefully people getting sick and needing treatment and unfortunately dying. We don't yet know how effective they are at preventing the transmission of the virus. Those original studies that were published, the phase 3 trials, are based around prevention of clinical disease. We will be progressively getting data over the coming months about the impact on transmission of the virus. It stands to reason that these vaccines will also prevent to some degree transmission of the virus, but we don't know how effective they are at doing that. So our strategy at the moment is to protect the population, to protect people from getting sick from COVID. Then we will reevaluate, see what the impact is on transmission, see how widely vaccinated our population is at a particular time, and look at that in terms of the vaccination in other countries. As I've said to the Prime Minister, I think about a year ago, I wouldn't want to predict more than 3 months ahead with this pandemic, and that still stands. I think at the moment the strategy is that we're going to be pretty much in our current situation for the next 3 months while we ramp up vaccination. We will progressively reevaluate the situation at the time. So we think they will be effective. The other thing we don't know is how long the immunity of these vaccines will last. So it may be that people will need additional doses of vaccines, possibly even annually. These things are completely unknown at the moment.
But there's pretty big implications of that. Doesn't that mean that hotel quarantine will have to stay in place for possibly at least another year? Or, I mean, essentially, even if people are vaccinated and they come to Australia, they could still be carrying the virus, transmitting the virus?
We don't know that yet. That's the data we have to get from the experience of the world's vaccinations over the next, what we call the phase 4 data, the real-time experience, and we will know that, probably within 3 months. We will have pretty good data on how effective the vaccines are at preventing transmission, and that will give us the potential to reevaluate things like international travel and hotel quarantine. So it's a progressive, real-time reevaluation of the public health situation.
And that's the approach we've taken the whole way through. We prepare for what we can know, and we deal with what's in front of us, and we constantly reevaluate we talk to each other, we listen to the expert medical advice, and then we take the actions as necessary. So in terms of the specific question you asked, Sam, that may or may not be true. It's just not in a position to be able to say that, but I don't think we should leap to any conclusion about what things look like 6 months from now or 9 months from now. It's just like this time last year. People who were making predictions this time last year and the months that followed, well, they proved to be horribly wrong.
Some special arrangements were made last year for the Indigenous communities and they were very successful. I just wonder, where are they being placed in the queue for the vaccine, and are there going to be special programs rolled out to protect them as fast as possible?
So the answer is yes. They've been specifically contemplated. The Indigenous Australians over 55 years of age will be in phase 1B, again on the medical advice, and Indigenous Australians under 55 years of age but over 16 will be in what's known as phase 2A. In addition to the general population distribution mechanisms being the hospitals, the state vaccination clinics, the Commonwealth vaccination clinics, the role fundamentally with the Astrazeneca vaccine for general practices, and we thank them, from phase 2 for the pharmacies, the Aboriginal community-controlled health organisations, or the Indigenous medical centres, will be providing support to Indigenous communities around the country.
You want nothing on health? Okay, we'll go general on other topics.
On vaccines,
yep.
Follow up to Michelle. What about people in rural Australia, people in big country towns? If you're in Ballarat or if you're in Bathurst, the Pfizer vaccine is so hard to ship, you may not have it at your local hospital. Will people in country Australia have to drive to the big smoke to get that vaccine, or should they just wait for AstraZeneca?
Well, I think we'll find that there's likely to be a very short difference in time between the rollout for the two vaccines, and so they'll be proximate within a matter of weeks, if not days. And so our whole approach has been to make sure that regional Australia is treated in the same way as urban Australia. That was something that the Prime Minister was absolutely insistent on from day one. I remember this time last year, Brendan, he was focused on making sure that no Australian missed out on ventilation. I remember that conversation. It was a very firm conversation. Equally, he's been absolutely focused on making sure that equitable access is a fundamental tenet of this, which is why we'll have over 1,000 points of presence. We went out to a tender to general practices around Australia to invite all general practices to do that, and we'll be going out in the coming weeks, if not days, to pharmacies to invite all pharmacies to participate, each subject to meeting the technical and training requirements. So there'll be multiple points of presence, state vaccination clinics, Commonwealth vaccination clinics, general practices, pharmacies and Indigenous medical centres.
Just one more on the access. So with that phase 1A, how do you actually choose which aged care residents or which quarantine workers get the vaccine first?
Look, obviously there'll be a process of ensuring that we work outwards, but at this point in time, the Department of Health is working on making sure that we have rapid distribution to as many as possible. By definition, somebody has to be first, and we will celebrate every vaccination, and we want as many people to be vaccinated as possible. So every vaccination will be a cause for celebration. Let me say this: we know that as you vaccinate a country, it will take time, and some people will want to be earlier. We've seen some examples of that. But the medical advisors who've protected us over the course of this last year, exactly this last year, are the ones who are continuing to provide the advice on the vaccine rollout.
Okay, we'll go to the other issue. I'll pick up the question you asked before. The Australia-China relationship is important to Australia. The China-Australia relationship is important to China. And we will, of course, remain absolutely open and available to meet, to discuss any of the issues that have been identified. But those discussions, as I've made clear, won't take place on the basis of any sort of preemptive concessions on Australia's part on those matters. I don't think any Australian would want their Prime Minister to be conceding the points that they've set out. Our position on that is very clear, it's very honest, it's very transparent. But of course we value the trading and more broader comprehensive relationship, and we will be taking up whatever opportunities we believe is going to best position Australia to be in a position to advance that relationship. Now, this is a matter that the former Prime Minister Howard and I have discussed on many occasions. As you know, I speak to him pretty regularly about these and many other things. It's a topic that some time ago, and even more recently, I was connecting with Prime Minister Rudd about these matters. So I'm always open to those who are very experienced in these areas, and both of those former Prime Ministers are very experienced in these areas. But how this is done, well, we will continue to pursue that through the ways we are doing that. It's an important relationship, but it's a relationship that will be pursued on the basis of Australia's national interests and without in any way compromising Australia's sovereignty.
Prime Minister, one of the world's biggest drug dealers has been arrested in the Netherlands, Church Lock. His organisation, Sandbourne Network, is considered to perhaps put 70% of the methamphetamine on Australia's streets onto the marketplace. How important is it that he be tried in Australia? Is there anything that you can tell us about his extradition?
I can't add much to that other than to say congratulations to all those Australian officers who did a fantastic job in pursuing this case. And it's a good example, Chris, of the areas in which Australia and China cooperate. Whether it's on issues of organised criminal gangs, counter-terrorism, biosecurity issues, these types of things, Australia has had a very good working relationship with China on those very important global matters. And we would look forward to having increasing good relations with them on issues of environmental management as well, not just around matters of climate, but particularly around energy technology, but I'd also say in terms of the health and of our oceans and plastics and these matters as well. So there are many areas where we work together and cooperate. This is another one, but you're right. This individual has been responsible for shattering the lives and destroying the lives of an untold number of people, including here in Australia. And he should be brought to justice, as he is, and he should pay for his crimes. Okay, we've got time for a couple more, but because we have our Australians of the Year gathering, and I think you'll be up there for that, and there's one amongst us.
Minister, a survey has found that most Australians don't want the date of Australia Day changed. Can I please get your reaction to that? Are you surprised?
No, I'm not surprised. No, I'm not surprised.
Can I just go back to vaccines, sorry, just briefly. The Pfizer vaccine requires 2 doses, and with the volatility in the global supply, are you making any contingencies to ensure that whoever gets those first 80,000 in the first week can get their follow-up in the stated time? And what is that recommended time that Australia will be pursuing between the 2 doses?
Well, Greg answered that before in terms of the time frame, and that is why we've been so careful, because you've seen in other places where these things have become... Well, no, we'll see. We had this discussion last Friday as well with Brendan was in that discussion with the premiers. You don't start what you can't finish, and finishing the job involves 2 doses. And so it's not only just that you can get 2 doses, but it's also the process of where you get those 2 doses, the digital system that is being used to ensure we know where they get them. And so it's good for people to go to exactly the same place, the same GP or the same clinic. So that is the best way of ensuring the continuity of that system. So that is what has gone into our vaccination plan. And it's the 21 days, Greg, as I understand it, is the time, and that's what we've planned for.
So 21 days and we're planning exactly that.
Oh, sorry,
that's right.
Prime Minister, could we see vaccination passports for international students later this year? Or do you agree with Daniel Andrews and Minister Tudge that it's very much a 2022 proposition?
Well, it's just too early to say. You know, I don't want to create any false expectations there or false hopes. The whole issue around vaccination passports is one that the EU is very focused on at the moment, and the way you can accredit particular vaccines and how that may potentially apply to broader movement of peoples over the course of the year. As the Health Secretary said, at this point there is no clear evidence about transmissibility So that of itself means that the question at this stage is somewhat premature. Our priorities in terms of entry into Australia, I think, are very clear. We're doing everything we can to get as many people back to Australia as we can safely without compromising the pressures that can be placed on our own quarantine system. I had a good meeting with Premier Palaszczuk on Friday in terms of what I'd describe as a bit of a supplementary capacity that potentially could be done, but that only relates to an overflow capacity around charter flights. It's not an alternative. We looked at the issue of broader expansion of facilities like Howard Springs earlier in the year. And if you want to get at least 5,000 people into Australia a week, which is what we had been achieving, then the idea that you can build some sort of national set of camps that can accommodate that, well, that's not a practical way to achieve it. The advice was, and I think it was right, and it was agreed to by the states and territories, that the best and most effective and safest way to do that is to take advantage of the accommodation capacity that sits through the hotel quarantine system that has been used. And that was the advice, and the other options were considered. I mean, if people are suggesting that we rebuild all the detention facilities that were built under the previous government in relation to the border crisis, well, we all know how much that cost and we all know how that worked. And so this has been a very effective way and successful way of doing it. I mean, over almost 80,000 Australians have come home since mid-September. And that's been done very effectively by the states and territories. Of course, there have been some instances where quarantine hasn't been perfect. But to expect perfection on that, I think, in a global pandemic is unrealistic. What matters is the supplementary supports that go around through tracing and other measures, which have proved to be very effective, particularly over this summer. Again, I thank Australians. Over this summer, we could have gone into a third wave. We could have been facing right now, as Australia sort of kicks in again after Australia Day, people going back to work, we could have been going in and in the midst of a very serious third wave. Australians, to date, have beaten that third wave. But, the fight goes on. Last one. Yep.
I'm George Brandis, coming home to holiday on the Sunshine Coast while so many Australians can't come home from the UK. What's your opinion on that?
Well, first of all, I just simply give you the facts. He came back for meetings here in Australia like many other heads of mission. He did not take the place of any other Australian. He got on the same place that anyone else would. He spent 2 weeks here quarantining before he engaged in those meetings. He actually had a meeting with me when he was back, which is the case for most of the heads of missions of our senior posts around the country, as well as with the officials and DFAT and other ministers. And he's an Australian, and he spent some time with his family in his home state while he was here. They're the facts. That's what happened. Okay, thanks very much.